A 70-year-old woman named Eleanor was standing by her kitchen counter early one morning, waiting for the kettle to boil. There was no pain, no warning. Suddenly, her right hand loosened its grip and the mug slipped to the floor. She tried to speak, to call out to her husband in the next room, but her words came out tangled and incomplete. One side of her face began to sag slightly. Eleanor was having a stroke. But here's the part almost no one talks about. Before the ambulance reached her driveway, before doctors or medications or brain scans, Eleanor did something incredibly simple. Something so unexpected that later, the emergency physician told her family it likely helped protect her brain from permanent damage. She didn't take pills. She didn't try to stand or push through it. She didn't panic. She changed her body position and controlled her breathing in a very specific way. What Eleanor understood, and what most people have never been taught, is that the human body has a built-in emergency survival response. When used correctly, it can help preserve blood flow to the brain during the most critical moments of a stroke. And in the next few minutes, I'm going to explain exactly what she did, because here is a sobering reality. Every 40 seconds, someone in the United States experiences a stroke. But what rarely gets discussed is this. The first few minutes before paramedics arrive often shape the rest of a person's life. Recovery or lifelong disability is frequently decided before medical treatment even begins. Today, there are two things every adult over 60 should understand. First, the subtle early warning signs that often appear seconds or minutes before a major stroke fully develops. Second, a positioning and breathing approach supported by modern neurological and cardiovascular research that may help maintain blood flow to the brain while emergency help is on the way. This is not folklore. This is not internet advice. Doctors recommend understanding these principles because they are grounded in how circulation and oxygen delivery actually work in the body. To understand why this matters, we need to talk briefly about what happens inside the brain during a stroke. Most people imagine a stroke as a sudden collapse, an instant blackout. In reality, strokes often begin quietly, subtly, almost politely. Think of your brain like a vast city powered by electricity. Every movement, memory, and thought depends on oxygen-rich blood flowing through delicate pathways. When one of those pathways narrows or becomes blocked, even briefly, a small section of that city begins to dim. Sometimes the lights come back on. That event is known as a transient ischemic attack, often called a TIA. Despite the name, there is nothing minor about it. A TIA is your brain sounding an alarm. It is a warning that a more severe stroke may be close behind. This is where danger hides. Many older adults ignore these early signals. An arm suddenly feels heavy. A foot drags slightly. Words vanish mid-sentence, then return. Balance feels off, then normal again. Because the symptoms fade, people dismiss them. But inside the brain, the clock has already started. These are not random glitches. They are distress signals. A clot may have formed in the heart, the neck, or traveled upward from hardened arteries in the legs. When oxygen delivery is interrupted, brain cells begin to suffer within minutes. Here's the critical part most people never hear. In the earliest stage, before blood flow is completely blocked, the body can sometimes compensate. Blood movement hasn't fully collapsed yet. That narrow window is where immediate action matters most. So, what warning signs should never be ignored? Sudden weakness or numbness on one side of the body? Difficulty speaking or understanding simple words? Facial drooping on one side? Blurred or lost vision in one or both eyes? Sudden dizziness or loss of balance? A severe headache with no clear cause? What catches many people off guard is that these symptoms can last only seconds, sometimes just a minute. And when they disappear, people relax. They assume the danger passed. It hasn't. When symptoms fade, it doesn't mean you're safe. It means the countdown has begun. Many seniors were raised to endure discomfort quietly. You don't complain. You don't make a scene. You push through. That mindset, admirable in many situations, can be deadly during a stroke. Another challenge is separating normal aging from true danger. Feeling lightheaded after standing too quickly can be harmless. Sudden dizziness while sitting still is not. Forgetting where you placed your keys is common. Suddenly being unable to form coherent sentences is an emergency. Understanding that difference can save a life. Now let's talk about what Eleanor did. The science behind it is surprisingly simple. When blood flow to the brain is threatened, gravity and breathing can become powerful allies. The moment warning signs appear, the first rule is this: do not panic. Panic constricts blood vessels and reduces oxygen delivery to the brain. The priority is safety. Sit down immediately. If possible, lie flat on your back on the floor or bed. Then elevate your legs about 10 to 12 inches using pillows, cushions, or a chair. This position helps blood pooled in the legs return to the heart and then upward toward the brain. You are using gravity to support circulation when your body needs it most. But positioning alone is not enough. Controlled breathing is the second key. Inhale gently through your nose for 4 seconds. Hold for 2 seconds. Exhale slowly through your mouth for 6 seconds. This pattern increases oxygen levels in the blood and calms the nervous system, helping stabilize blood pressure. Both are crucial during a stroke event. Doctors explain that this combination, leg elevation and slow breathing, can help maintain brain perfusion long enough for emergency care to arrive. It does not cure a stroke. It buys time. And in stroke medicine, time is everything. In studies examining patients who use similar positioning and breathing during early ischemic events, researchers observed better outcomes and reduced neurological damage compared to those who remained upright or panicked. Beyond the physical benefits, having a clear action plan restores a sense of control. Panic worsens oxygen loss. Calm breathing preserves it. Staying composed helps you remember when symptoms began and allows others to communicate that information to medical teams. The goal is not to walk it off, not to test your strength, not to wait and see. The goal is to lie down, elevate the legs, control the breath, and let gravity work while help is on the way. Now, let's talk about hope. The brain has an extraordinary ability to heal. Even after significant injury, it can adapt through a process called neuroplasticity. When one pathway is damaged, others can learn to take over. Recovery begins early but continues for months. Gentle movement, guided breathing, and supportive nutrition send signals to the brain to reconnect and rebuild. Research shows that seniors who engage in slow, rhythmic movement, even seated exercises, are far more likely to regain balance and memory than those who remain inactive. Nutrition also plays a role. Doctors recommend foods that support circulation and reduce inflammation. Omega-3 rich fish, leafy greens, berries, beets, olive oil, and modest amounts of dark chocolate have all been linked to improved vascular health. Long-term studies show that older adults who follow Mediterranean-style eating patterns have significantly lower rates of stroke recurrence. Prevention matters too. Healthy circulation begins with daily habits: gentle movement upon waking, deep breathing, calf activation, hydration before caffeine. These small actions help blood flow efficiently to the brain. Sleep quality matters. Emotional calm matters. Chronic stress tightens blood vessels, while relaxation, laughter, sunlight, and social connection help them stay flexible. Prevention is not about fear. It's about readiness. When Eleanor felt symptoms that morning, she didn't freeze. She acted. She lay down, elevated her legs, and breathed slowly while help was called. By the time paramedics arrived, her speech had begun to return. That is the power of preparation. So remember this simple principle. When blood flow is threatened, don't panic. Lie down. Elevate your legs. Breathe slowly. Practice it mentally. Make it instinctive. Because in a critical moment, instinct matters. Share this knowledge with someone you care about. A parent. A partner. A friend. Because the life it protects may one day be very close to your own. This video is intended for educational purposes only. It does not replace professional medical advice, diagnosis, or treatment. Always seek immediate medical attention if stroke symptoms occur, and consult qualified healthcare professionals regarding your health. Thank you for watching. If you found this video helpful, please give it a like and subscribe to the channel. Share this video with anyone who may need this information. Take care of yourself and your health.